and it gives me a high. It's sort of a boost.
Yeah, right.
It really is.
Hey everyone, I'm Madonna. This is David.
Hello.
And Robert F. Kennedy Jr. has been in the news in a lot of negative ways, but one of the things he's talking about is antidepressants in kids and how a lot of dietary things can really help conditions like depression.
Right.
So, from a naturopathic perspective, I remember about 10, 15 years ago, I was at it might be 20 years ago now, but I was at a seminar that was all about the brain. It was about autism, anxiety, ADHD, depression, that type of thing. And they were showing the research that showed that any of those conditions are to do with inflammation of the brain.
Right.
So, you can't have depression without inflammation in the brain. You
Mm-hmm.
can't have insomnia without depression, without inflammation of the brain. You can't have autism so basically these things are based from a naturopathic perspective. Inflammation
Mm-hmm.
messes with the brain and stops its ability to work properly.
Okay.
Yeah. So that's sort of and when I was just drawing this up before, that means that this frontal area, so this is the frontal area of the brain. So when it's not up and running, we don't make all our feel-good hormones.
There's a few reasons it doesn't up and run though.
Absolutely.
So I'll give you a couple of examples that we might look at. So things like ADHD and autism, there's an irregular brain pattern going on related to the prefrontal cortex.
Yes.
And also people with trauma, when they do brain scans, this part of the brain doesn't light up.
Yeah.
Often with people with bad traumatic experience in their childhood.
Yes.
This actually doesn't, the prefrontal cortex doesn't function so well.
Yeah.
And so looking at like how would inflammation work in those kind of areas.
Yeah. So, and this is sort of like when our survival patterns are in the rear of the brain.
Mm-hmm.
So, one of the most very basic kinesiology things, kinesiology 101, when you want to calm your stress, you pop your hand at the base of the skull and your hand on the forehead.
Right.
And what that does is gets your conscious brain, which is your conscious thinking, connected to your survival patterns.
Mm-hmm.
And every time you do this, it helps to create new neuronal pathways from the front to the back of the brain.
Mm.
So I had a client, Trish, many, many years ago, and I'm sure she won't mind me saying this, but she was in charge of about a dozen girls in an organization where there was a lot of phone, they were basically phone people. Excuse me. And as soon as any girl would walk into her office, if they were about to complain, she said, hand on the forehead.
Right.
And before they would even start complaining, she would make them put their hand on their forehead, because that helps us problem solve. When people are complaining, the frontal cortex isn't working. Because they're not finding solutions. They're not even aware there might potentially be solutions.
Because they're stuck in the midbrain.
They're stuck in the midbrain, which is where all the amygdala and the stress and the fight and flight and rage, anger, frustration, pain, punishment.
Some good things are in the midbrain too, like attachment, but we're not talking about them.
Yeah.
Like the midbrain has some really positive purpose.
Absolutely. It's where all our memory stuff is. Yeah, definitely. And if we've got good, happy, healthy memories, it's because we've got good, happy, healthy hormones whizzing through our brain. But what drugs like SSRIs can do is actually shut down the production of serotonin in your small intestine, because the small intestine makes it leak.
SSRIs, they're the like
serotonin. So basically, the drugs that support depression. The idea is that we're the serotonin reuptake inhibitors.
So that means that they're trying to produce more serotonin.
No, they're trying to recycle it for longer.
Okay, yeah.
Yeah. So it doesn't ever create more serotonin.
Right.
That's one of those furfies out there. But what it also does, because the drug bypasses the gut, it actually can long-term shut down your small intestine's ability to create serotonin, but also melatonin. So, that's why so many people end up, when they're on drugs for depression, they also end up on drugs for insomnia, and they wake up feeling really exhausted because there's no oxygen getting to the brain overnight. It's really missing out on oxygen. So they're sort of like suffocating themselves to sleep when they're taking these drugs. So if we're taking a drug that's making us wake up feeling exhausted, you've got to think, did my brain get oxygen for 6, 8, 10 hours?
Is depression classified as a mood disorder?
Yes.
Right, so it's called, like, the general descriptions they use in psychology is low mood.
Yes.
And so we've got a situation where what does low mood really mean? I mean, I've I get depression from time to time,
Yes.
and one reason that I'm an artist is because when I make art, it makes it go away. And that's an interesting thing because I don't know if that has much to do with inflammation, but it's always done that.
Right.
For some reason, painting's a really good processing thing,
Well, what painting will do is
or other
get
art
the
forms.
right side of your brain up and running.
Well, that's
So what it
interesting.
might end up, like piano and guitar and
Yeah,
things
yeah,
like
because
that, the more we do that type of thing, the more it's creating those connections from left
yeah,
to right
which
sides of the brain.
all creative practices do that.
Yes, absolutely.
Mhm.
So therefore, if you've got your kids at school and your kids having a problem with maths, quite often they're, in the old days, I don't know what they tell them these days. No, I don't want to go there. Anyway, but in the old days, they'd say, well, you've got to take up piano or some sort of either
Oh, did they?
sport, things like soccer
Mhm.
that use both the left and the right feet, or tennis that uses the left and the right arm, because anything that's using both sides of the body
Yes.
is going to help that
Integrate.
connection between left and right, the logical and creative hemispheres.
Mhm.
Yeah. So what? And
And
so it's
exercise must reduce inflammation.
yes,
Right.
100%, and it
So
supports the microbiome in the gut as well. So they've done some studies where
because
they looked at
they found with depression, exercise is one of the best things.
absolutely.
So that means it must stop because before I injured my knee, I'd run 3 times a week, and I
Yeah,
can't do that anymore. And
at
you
the moment.
notice, and you notice that when that happens, actually maybe moods that you had before, you could get rid of them with running 3 days.
Yeah.
You could just wipe them off the slate, and you wouldn't get any.
Well, I went for my first hour walk this morning since I tore my butt muscle,
Mhm.
going back 3 weeks ago. So, and I've taken about 8 Steven hands today to really, make sure I haven't done myself any damage.
Right.
But I should go see my chiro tomorrow and, make sure I'm all balanced in there because I could feel it, it was nudging away in my butt. I could feel that, that attachment of the hemi. It's not perfect yet, but it's 1,000% on what it
Oh,
was.
that's good.
Yeah. But yeah, so with and you sort of said about survival before, so survival patterns. And did you know that things like our insulin, because blood sugar can be about getting energy to the extremities. So our blood sugar is constantly being balanced during the day, depending on what needs our body needs. So
Right.
our brain actually needs heaps of glucose to function.
Mhm.
Which is why it's interesting that some people go on ketogenic diets, they do brilliantly, but it often takes about 6 weeks to change your brain from running on glucose to running on ketones.
Right.
It can do it, but it takes time to do that switch over.
Mhm.
And unfortunately, to switch it back to glucose takes nothing.
Oh, right.
That's like you have a Mars bar at the shop because you're having a moment, and then it's another 6 weeks to get you back into ketosis.
Mhm.
Sugar is so bad for the brain.
But inflammation too.
Yeah, so when our insulin is high, it not only puts us in fat storing, but it starts the whole metabolic process.
Mhm.
It's hugely involved in adjusting just about every other hormone in your body.
Well, what happens then if people have like some things? So we'll go into diet in a minute, but some things like chronic stress. So
Yes.
people find themselves in situations either at work or in their family system where they're actually chronically stressed because of the people around them.
Yes.
Now that's going to be hard to deal with. You can give people can take stuff to feel calmer.
Yeah.
But they might have some difficulty.
Absolutely.
Depression's a slowness.
Yeah, but
It's
and it's sort of, I always joke, we've got products like say Energy X.
right.
And then I've got Carmex. So, but the core of both of them are activated B vitamins.
Yeah,
There's magnesium and then some other things like taurine and potassium and stuff, so in different combinations. But basically, I sort of joke with my clients, well, you need some uppers and downers.
Right.
So we need to pick up your energy in the morning and we need to calm your brain at night. If someone keeps going back into the lion's den because they've got a bully at work, they've got a bully at home, they've got family members who are just not treating them respectfully, with that care and love and concern that we would always hope for, then you're constantly going back into the lion's den. If you're not taking supplementation, then disease is on its way, without a doubt. Because stress depletes
those high blood sugar.
Yes.
Stress, cancer.
Yeah, cancer.
It
big
increases
one.
cancer.
Absolutely.
And so, therefore reducing stress is a good thing if you can. But sometimes people are locked in that.
Yes.
and they can't really get out.
Yes.
So
And actually, it doesn't matter whether you have a massage or whether you get Reiki or whether it does not matter as long as you have support people in your field. And I always say it's good to have 2, 3, 4 support people. So whether or not there's a counselor in there or a natural, it's people that you can talk to. So then you intuitively go, who do I need today? Do I need to go see David? Do I need to go see Sean the Chiro? Do I need to go see Gabriella, my crazy, Kundalini specialist? Who do I need today? So it's sort of because when we're in that trauma and crisis,
or a friend who knows how to listen.
yeah, but not keep you in your crap either. That's the problem with a lot of friends, because sometimes they're just like, oh, poor darling, and it keeps us in it. So we need someone who'll see something from another perspective as well.
Yeah, that's right.
Because especially when we're not getting our story out of our head, the more we think the same story, the more we're laying down those neuronal pathways to make us think what we're saying is correct. But it might not be correct. There might be another, and this is why people love coming to see you, because they go, oh my gosh, I never thought of seeing it like that. They love another perspective.
Yes.
And let's face it, it's always easy seeing another perspective for someone else's problems rather than our own,
Well, I think Carl Rogers, who was one of the people who's really responsible for modern counselling.
Yes.
He said that when somebody finds themselves in a room with a counsellor,
yes,
he goes, by that time they've normally had advice from all their family members, from this, that, and maybe even a lawyer.
Yeah.
But that didn't solve the problem. The advice being given isn't necessarily helpful. But when you see somebody who's a trained counsellor or a therapist of any type, they're actually trained, like you're especially trained to listen, which everybody isn't trained to do at all.
Which seems like an odd thing, because I'll bet 99.9% of people out there think they listen really well.
Well, of course.
But I was at a speech contest about, I don't know, 30 years ago, maybe 35 years ago. And I remember the speech was on, it was on listening skills. And it was saying how one of the hardest things to do, especially when you're in the middle of an argument, the hardest thing to do is listening, because your brain in the moment of that argument is trying to get your thought across.
Yeah, and
while
what you're going to say.
Yeah, so while someone is having their sentence and we're allowing them to speak in the middle of an argument, our brain's already coming up with why that's wrong. It's already, you're wrong, I'm right, and this is why, which means we're not listening actively. We're not doing it. We're trying to create the thing that I'm right, you're wrong.
Right.
Which isn't active listening.
Active listening is more like curiosity.
Yeah.
Like, so you're curious, and you're curious to, like, the thing about curiosity is it can take you to a different level.
Yes.
From, because you want looking for something more.
Yes.
And so when people have got an issue that they can't resolve, their left side of the brain has already fully worked through as much as it could.
Yeah.
Right.
Yeah.
They're at their logical limit.
Exhaustion. Yeah.
And so coming up with something new in listening and something more curious actually takes a bit of a creative thing.
Yeah.
And it's funny, in counselling, a lot of the higher skills are creative skills. When one's called an empathetic challenge, when you actually challenge somebody with their current thinking to see if they can come up to another level. And that's creative, because we find something that we didn't know before.
Yeah.
Right. And that's part of the thing of getting out of it, because part of the trap, especially in things like circular thinking, you're just thinking these same thoughts all the time and they're not helping, and they're going through your head. And what you're really trying to do is work out something new that you could add.
Yes.
Because often it'll be in interpersonal relationships, whether it's at work or at home, it'll be something unresolved that you're not sure how to do that. And so by finding something new, by being creative, a new way of looking at it, or you might find a new thing to say about it.
Yeah.
Or with something like psychoeducation, by explaining the condition properly and what the options you can do about it, all of a sudden you've got all these new things, which is creative.
Right.
Like, for example, we're talking about depression, and like if we want to look at diet, right? Well, what do we know about diet from a natural health perspective? Right? So the things that make, so depression will be, so people use that word, but really what's happening in our brains is we've got serotonin, like we mentioned with the we've got serotonin, happy hormones, we've got dopamine, we've got oxytocin, we've got what's the other one?
Melatonin.
Melatonin, but also the endorphins.
Yes.
Do you know what I mean? And so we want those
your
things.
adrenaline, noradrenaline.
Yeah, we want those things working.
Yes.
Right? And the thing is that for those things to work, you need base foods that give the precursors to make those neuroreceptors work.
Yeah.
So if you've got a bad diet, it's going to be obvious that you're not making the raw ingredients to make those neuroreceptors.
That was, can I say something? So that was one of the things that RFKJ said in the last couple of days. He's in an interview with Sean Hannity, which hasn't been released yet, but it'll be out in the next 24 hours, 48 hours or something. But basically he was saying that one of the biggest problems with the brain is it requires lots of nutrition. And this is where people get told they've got a chemical imbalance and you need to be on your drug for the rest of your life.
Right.
But the chemicals are made of nutrition. They're made of vitamins, they're made of minerals, they're made of amino acids. So they're made of protein, they're made of fats. So when we have a diet that is 55% or more ultra processed, which is the problem, and this is what RFKJ said in the last couple of days, we've got, and we're the same here in Australia. So this is not just America. I think there might be more genetically modified foods in America than there is in Australia, and hopefully they'll start, because when Obama was in, I loved Obama for a while, but when he was in, he defunded anything to do with finding out if there was any problems health-wise to do with genetically modified foods.
Right.
He also made it so, have you heard of poop transplants?
Yeah.
Yeah. So here in Australia, they're still just poop. So, you basically, they do a process. It doesn't cost the earth. In America, Obama changed the law so that poop was a pharmaceutical product. So it was like $15,000 to $30,000 to have a poop transplant.
Oh. Which is taking something from one person's bowel and putting in another.
Yes.
To help regrow.
Change the microbiome. Yeah. And, you were saying before about exercise as well. You're absolutely spot on. We started talking about Dr. Flavio Catagiani the other day, who proved that testosterone was not the bad guy for men. Right. It's not what makes men angry. It's not what makes men violent.
It actually makes them pro-social.
It does. That's been a lie for a long time. That's been anti-man.
Right.
It's an anti-man belief that testosterone is bad for men. So,
but then when you see the people who are like doing they're changing from male to female.
Yes.
Female, they take testosterone, and I've listened to a lot of interviews. They say it enhances their energy.
Yes. So it's a
very energetic thing.
Yes, one of my men, he's been getting testosterone injections. I don't know. 5 years, something like that.
Right.
And his testosterone levels are now building up to such a level that his doctor's refusing to give him them as regularly as he would like, because he knows how he feels and he loves the way he feels with that good level. He's worried about the preservatives and things in them, as people should be.
Is there a natural way to increase testosterone?
Well, it's hard from the transgender perspective, because you're trying to enhance something that is there naturally. We've all got estrogen, progesterone, testosterone. We've all got all of the sex hormones at all stages.
They're made in the pineal gland, aren't they?
Well, the HPA is involved, but then there's also, so the HPA is involved in how much we create. So we can, and tummy fat's also involved.
Right.
So when we have too much tummy fat, and I think the percentages...
Oh, that reduces testosterone.
Yeah, it converts natural testosterone in men. It converts it into a form of nasty estrogen.
Right.
And estrogen's the nasty one. So
good estrogen. Not good estrogen.
Good estrogen's awesome. Yeah, no, there's good, but then there's xenoestrogens as well, and this is the problem. Xenoestrogens are pretend estrogens that act exactly in the same way in our body as estrogen does, so therefore our cell receptors...
modified to get it there?
Oh, man, they've just bastardized everything. Dirty butt-butts.
Anyway, but let's get back. Let me make a point about this. So you started talking about SSRIs, but let's talk about something different. So... what I know is that I get quite a few clients with ADHD.
Sorry, I've got a fly in my throat. I don't really.
yeah. So I see quite a few people with ADHD.
Yes.
Okay. Now, what I notice is that, and I've got quite a few friends with kids.
Yes.
Right. And as soon as that happens, the parents go, which one of us has it? Which is normal because one usually has it. And then So it's like so they'll go to the pediatrician, right, and they'll come away with a script,
Yes.
right, and a diagnosis. And you need that for school,
Yeah.
okay, because they won't get any help. So you get that. But what I find is that, and also one of my kids has got it too, so it's okay. But they don't give you any information.
Yeah.
Now, this is a segue into what we're talking about, because in the counseling protocol for ADHD, the first protocol is parenting training.
Yeah.
And that's because your kid with ADHD is going to react the same to normal behavioral training. It doesn't work. So if an ADHD kid gets authoritarian parenting, they're likely to end up with what's that thing where you hate authority? They call it
ODD, oppositional defiance
ODD.
disorder.
And ODD seems to come out of authoritarian parenting.
Yeah,
The
absolutely.
kids go to school, they get authoritarianism from the teachers. All of these things make the ADHD worse.
Yeah.
Right. But this is just starting. But then we know that. But then we know things about it. So what I find, I get people coming, they don't know anything about it. So I say, go watch this video and go watch that video, because the more you know about it, the more you can help regulate it, because it's emotional dysregulation and a cognitive dysregulation. And so there's a lot to work with depending on how severe it is. And then, the kids are sensitive at all backlogs, they go to school. And by the studies say by the time they're 10, they've been told 20,000 times more than the other kids to pay attention or stop. So they've already got this difficulty. But what happens is but when you understand it more and more, you realize that, so they get the diagnosis and they get a drug. And I'm not against the drugs, okay, because I think short-term use, anything can be okay. But what happens is they don't give you any further information, because there's a whole bunch of ways to make it better, and diet's one of them.
Yeah.
Because if you've got, like, it's a dopamine problem and a noradrenaline problem, so they can't make the adrenaline, which is the energy, to keep them focused like normal people. But there's herbs and there's also foods.
Now, you say
help.
that you agree with them, but you have had side effects to these drugs. You've had psychoses because of these drugs.
Which drug?
Antidepressants. You've had really bad effects to these drugs.
I only took them for like
but it doesn't
20 days. I took one.
So you can't say that you agree with them.
No, I'm talking about the ADHD drugs, because they're just like they're speed. They're pretty simple. No, but sometimes,
6 molecules different to cocaine.
Well,
how can you recommend that for children?
Sigmund Freud invented psychology on cocaine.
Yeah, whatever.
No, but the point is that that's not what I'm saying. What I'm saying is that there's a whole variety of ways to do it, and that's where the creative thing comes in. Like, for example, there's also physical activities that produce, like the things, depression, like running. Why does running make depression go away?
So why does exercise make the depression go away?
Well, the thing is, let's just stick with the ADHD, right? So if you follow the model, so in counseling, we learn to critique the medical model as well.
Yeah.
And especially the drug model, because there are problems and people have problems getting off them.
Yes.
Right, as well as getting on them. And so anyway, but when you look at it more creatively, you find not only can food improve ADHD, because depression's the same, but also activities can improve it.
Yeah.
Like those people, they need something. So the kids with that, they want to do sport because they can focus then. They're trying to, and also naturopathy can do a whole bunch of things to assist it as well.
Yeah.
Right. And more, and that's like giving you a whole bunch of options. Some things suit people more than others. Some people find some, and the more options you have for looking at it. Do you know what I mean? Like, because what we're going to talk about, like, SSRIs, and what is it that, because that's what the article's about, John Robert Kennedy. It's like, so with those things, say, I don't know many people on them, but I know people trying to get off them.
Yeah, yeah.
And getting off them seems to be a problem.
Yeah, we've had joint clients who have had massive issues.
Yeah.
And that, because all of these drugs, all of the drugs will destroy the way your gut works. The only way that drugs work is by destroying enzyme pathways in the body.
Right.
So
Okay.
every drug you take that gives you an intended effect, it's because it's destroying an enzyme pathway somewhere in the body.
Okay.
So therefore, it doesn't matter whether it's for blood pressure or whether it's for cholesterol or whether it's for mood or whether it's for anxiety. It doesn't matter. There will be side effects. You will be destroying pathways in your body that were designed to work a different way.
Mm-hmm.
So there, you know, there's no such thing as a safe drug.
Yeah, but also do herbs have some side effects?
For some people.
Mm. See, and the thing I'm making, the reason
But it's not the same because herbs are
yes.
in a more natural form.
Mm.
They're not synthetic. They're not made from what's all the Rockefeller stuff? You know, they're not made from the oil industry byproducts.
Yeah.
You know, so things like sorbeline, it's like petroleum.
Mm.
You know, so people use it all over their skin and they think it's a barrier cream, but they're putting petroleum on their body.
Same as Vaseline. That's
Vaseline, just awful.
petroleum-based product. I remember
Yeah.
reading that as a kid.
Ugh, yuck. Anyway. But yeah, just have to be careful. And I think the nice thing about Robert F. Kennedy Jr., I think people hopefully, as they start building trust with him, they'll start going, I am not my diagnosis. They've been told, you've got depression, you've got a biochemical imbalance, you need this drug for the rest of your life. Some people are on these drugs for the rest of their life because they've never been given any other information.
And that's interesting, isn't it? Because if something isn't inherent and it's caused by an external thing, it should be called an adjustment disorder.
Yes.
And so therefore it's something that isn't on your permanent record.
Yeah.
Because when it's on your permanent, like it's like kids getting diagnosed with ADHD. I mean, they're starting to put moves in now to try to make it harder for them to get their license. I mean, there's also, like, getting a diagnosis can be good, but it can also not be helpful either. Because there's heaps of adults, because we didn't have ADHD when I was a kid.
Yeah.
But I know a lot of people who'd easily be diagnosed.
Yeah.
But is that helpful?
Yeah.
You know?
And people can get addicted to their diagnosis as well.
They can get addicted to the drugs too.
Yeah.
I mean, because don't forget with ADHD, they're taking amphetamines and they're, you know, it is what it is.
Yeah, that's why they end up needing harder drugs as they get older.
Well, then if they can't make, and the script's expensive to maintain because you need to see the, not because the doctor can't do it, so it's really expensive.
Yeah.
Right. So you need to see a specialist regularly. I think it might be at least every 6 months. And so they've got this maintenance cost on top of the cost of the product.
Yeah.
And so what happens if they can't afford it? And at the moment, you can't get any ADHD medication.
Right.
It's out of stock in Australia.
Oh, really?
Yeah, yeah. That happened it happened in the US last year, and all the ADHD people couldn't get their medication.
And this is where people need information that there's other solutions.
But, well, that's right. See, but in America now, they're holding it there, and now we don't have it.
Right.
There's a lot of people who are used to their ADHD drugs, and they can't get them.
Right.
So what all those people do, they might try to get some off the street.
Right.
Right, because at present there's a shortage. Like, you can't get it. I know it's not available. And so, no, but it's just an interesting thing. There's different ways things become unavailable to people, and they're addicted to them.
Oh, absolutely.
And then they'll find that they might start drinking or something, which could be worse.
The Therapeutics Goods Association in Australia, which is probably similar to, say, the FDA or the CDC in America, you know, it has a list of about 200 natural substances that it wants under pharmaceutical control.
Oh.
And then that will make it unavailable, more expensive, and not available in supermarkets and places like that. So it's going to be dreadful if that happens. Right. It's already happening in places like the UK and Canada, has been for years. In the UK, when I was sick there about 10, 15 years ago, you could not get any decent doses of anything because I'm looking at ingredients and going, why is there aspartame in this? You can't buy vitamin C without a neurological toxin? Really bad. Really, really bad.
At least it doesn't have sugar in it.
No, yeah, well, let's cause diabetes and dementia instead, you know. So, and this is often what happens. And I think this is the thing that, again, hopefully Bobby Kennedy will have some influence over, is giving people the real information about these things, saying if it's transient. So if I'm depressed because my husband has just died and I've been married to him for 52 years, obviously I'm going to be depressed for a little while. Does it mean I need to be on a drug for the rest of my life? Or should I go have 3 to 6 sessions of counselling and avoid the medications? You know, Like it's people need solutions.
People need options too.
Options.
Because some solutions don't suit some
No,
people.
that's what I meant. I meant options.
Because some people, because like with depression, it's like considered a very slow mood. So it's hard, like even with communication, slow out, slow in. Hard to absorb information, hard to refine information.
No, I don't know what's happened with 5-HTP here in Australia over the last couple of years, but 5-HTP has been one of my biggest sellers for 30 years. It's one of the ingredients we need to make serotonin.
Mm-hmm.
And
right.
in the last 2 years, I've had more. So I suspect the TGA has made it so that they have to have something else in there as well.
You had some of that is.
Yeah. But I've had more.
Ago.
But I've had more people have issues with 5-HTP powder in the last 2 years than I have in the previous 28. Suspecting that they are getting that hyperserotonergic condition, which I don't necessarily believe that it's true. I think there's something else going on there.
Okay.
Because there's no proof of serotonin toxicity. There's no proof of it. It's just one of those weird things. But when we do sort of start to balance our insulin out, we start to make our body more alkaline.
Mm-hmm.
Because acidity, like lactic acid, so when we have to run and, fight the bear, the tiger, the lion, whatever, we need that energy whizzing through our body. Part of the whole reason why we can do it is because our whole biochemistry changes in that moment. If we don't fight or run or do that energy, then the acidity builds up in our body's tissues.
Mm.
And then we start getting aches and pains and cramps. And this is what happens again when we've got a traumatic, home life, work life, friendship-based, something like that. We're going back into the lion's den all the time, but we're not utilizing the energy. And that's why going for a run is so important, because part of that is about burning all of that off and you're sweating out the toxins.
Yeah, that's right. So exercise. So if you've got depression, there's so many ways that you can deal with it other than drugs, or as well as.
Yeah.
Right? And the reason I say as well as is because if you do want to wean yourself off the drug, you want to have the as well as in place before you go off.
Yeah.
Right? Because it's like, because people really do need some extra help. There's a reason that most people drink a couple of glasses of wine during the week, because being able to sleep, So everyone's drinking a little bit, they're having coffee in the morning, and they're all psychoactive substances, even if they're not a problem.
Yeah.
And that's why I don't get too concerned about the drugs, because with the drugs, one thing about them is they're really cheap. And so it covers that part of the market.
They're cheap because the government is subsidizing them.
Again.
So, that's our taxpayers that are paying for something that kills people younger, because that's what they do. They shorten people's lifespans.
Yeah, so the idea
they shouldn't be taken for decades and decades like people do. People do.
Mm-hmm.
And they add one drug after another, after another, after another. And they're cheap because I'm paying for your drugs.
Mm-hmm. Yeah, but I'm just saying that
I don't mean your drugs, but
Yeah, but to come into a more metabolic health way of looking at it, you need to improve your diet.
Yeah, absolutely, 100%.
But first you got to look at what in the diet is actually contributing either negatively to your depression.
Yeah. Where's my fat? Where's my protein? Where's my fiber?
Right. But firstly, a bad diet might be helping keep the depression there.
Absolutely.
Right? But then working out what a good diet is will be quite individual to different people, because everyone's got a different way.
They did a study on depressed people over in the UK, maybe, I'm guessing, say 8 to 10 years ago, something like that. And they had these people in some sort of brain scans, and they just had them visualizing. So these were overweight, chronically depressed people.
Mm-hmm.
And they were people who could not stick to a diet, and they just wanted to see what happened. So what they got them to do was they got them to visualize eating a healthy meal. Mm-hmm. And not a lot happened in their brain. They got them to visualize eating their favorite bad meal, and their dopamine levels went up like 4 times.
Right.
So it's just this massive burst of dopamine from visualizing you're being naughty and having something delicious. And
visualizing is so powerful. What did they find? They did tests, and they found that they had 2 groups. One were doing weights.
Yep.
The others were imagining they were doing weights.
Yeah, right.
They both put on muscle mass.
That is incredible.
And they've done a lot of studies with that of just imagining things, and the people end up getting, and because they give lectures on this, and in the thing they'll give examples like that whole imagine you got food in your hand and you're about to bite it,
Right.
and you salivate.
Yeah.
And you're sitting in an auditorium full of people. There's no food there, but your body starts to make that reaction automatically. And there's a lot of things like that we can trick ourselves into,
Yeah, totally.
and trick ourselves out of if we're really good.
And this is why anxiety is such a problem, because your brain doesn't know what's real or imagined. So when we're imagining life as bad and we're imagining the same,
that's an interesting pull from that.
Yeah, so the brain is constantly going over those same stresses and traumas, and they haven't even happened 99% of the time.
Mm-hmm.
So it's like when we're going home to that traumatic place, or we're going to work to that traumatic place, and we're already visualizing it before we get there.
Mm-hmm.
So then what are we creating?
Mm-hmm.
How much are we creating by having that fear or that anxiety about going into that space? Because that will then create a frequency in us that isn't loving and welcoming and happy and, forgiving or whatever it is we need in that space. It's going to be affecting the way we're putting ourselves into that space. Visualization is powerful, whether we're doing it for good or evil.
Although when you've got depression, you're stuck in it, and it's really hard to get out and start moving.
That's why I hate the stakeholder capitalists. They're good at visualizing what they want.
Right.
They want us all eating bugs.
I don't know about those freaks. I'm a vegetarian.
Well, one of my vegetarian clients actually eats grasshopper protein because she figures it's good for the planet and it's good for her.
Well, it's not strictly vegetarian.
Well, it's not vegetarian at all. It's hilarious. I did say to her mum, she does know that's not. Anyway.
But the thing is, with any condition, there's lots of ways to deal with it.
Yeah.
Not just one.
Yes.
And having drugs as an option is good. But they should be made an option. And they should be made...
But people should be given the real risk-benefit analysis going on it.
Yeah, sure.
So many of my clients have been on drugs for for antidepressants, for example, for 3, 6, 9, 12 months, and they just keep doubling the dose and doubling the dose and doubling the dose and doubling the dose. They end up with no libido. They end up with no energy. They end up sleeping all weekend. They have no life. They lose their ability to enjoy anything. So...
Well, and if you can... So I had a friend, a young person who's on... antidepressants, one of those ones, like one of the main ones they use, I can't remember.
Like Zoloft or something.
Yeah, that was it. And they were also on the medical cannabis program.
Oh, yes.
And so I worked with him, and we did the Zoloft first, and I taught him how to taper, and he tapered them. But then he just went off the medical marijuana program.
Yeah, right.
And now he's not taking anything.
And how's he doing?
He's good.
Because one of my clients...
He's good.
And
there's a friend of my... a friend of a friend, and not a client, but he's just really good. And he's not on either of them anymore. And it was because it's from the tapering.
So one of my friends, within 24 hours of running out of CBD, just goes totally nuts.
Yeah.
So it is not just a nice, delightful, natural little thing.
No,
it makes his life really, and his whole family... Everyone's terrified of him if he runs out.
It doesn't
within
matter.
Hours of
just
a dose.
About any addiction to whether any type of drug, really.
Yeah.
It's going to be, depending on the person, some people, but a lot of people end up with psychosis from trying to stop things.
Yeah.
And, I mentioned earlier that I took antidepressants once in my life, and it was a tricyclic one. And after 20 days, they don't tell you anything either. So I just thought, I'm going to stop taking it, and it went into psychosis. But no one told you anything.
Yeah.
And then,
so the sort of side effects, the common side effects going off SSRIs are nausea, headaches, diarrhea, sleep problems, weight changes, sexual dysfunction. But, I've had people who've had it.
Any of the psychological stuff.
No.
That we know happens.
Well, as well as anxiety and nervousness, shakiness. I've had people with the brain zaps. For like months and months and months and months and months afterwards. And it also destroys the microbiome in your gut, so you're less likely to be able to keep eating the same way. Because every drug affects your gut. It does, because your microbiome, because they're synthetic. They're synthetic, they're not natural, so therefore the body is going to do what it can. It might be the fact that some of the bacteria are designed to help to break down toxins in the gut, and then we just use them up. I don't know why, but there will be something going on. And that was one of the things that Dr. Flavio Catagiani was saying in relation to exercise. So he had a whole bunch of footballers who, even though they were big, beefy men, firstly, he found there was nothing wrong with their testosterone. That wasn't an issue for them. But he found they had really healthy microbiomes. So even if they've got a crappy diet, exercise protects the gut-brain axis when we're doing enough exercise.
Yeah, so the problem with a lot of people with depression, they find it hard to leave the house even.
Yeah.
What to speak of going for a run up the street?
Well, buy a treadmill and a little bouncer
No,
for the house.
I'm just saying, once somebody gets into that low mood, stop, they just might want to stay home, not go out.
Well, that was something you said a few days ago. You had a client who was saying that they'd always assumed the reason they stayed at home when they were depressed was because they didn't want to go out, but they realised that they were actually keeping themselves at home.
Right. Yeah, well, because often there's a social phobia associated with it, because the thing about that, when you've got depression, you feel really ashamed.
Right.
Do you know what I mean? Because there's personal feelings that go with these things.
Yeah.
When you're not feeling good, you feel all sorts of emotions like shame. And then if you put on weight, you feel like, you go to the beach and you feel embarrassed.
And I think shame is the lowest vibration of all the emotions. So I think it's got a vibration of like 20.
But it's really...
and blame is like 30.
But shame...
so guilt is about 50.
But shame's really common.
Yeah.
And a lot of the things with childhood trauma, or people feel a lot of shame.
Well, shame is what other people put on you.
All of them.
Yeah, and you start to feel itself because of what other people say about you. People shame us into feeling ashamed.
And that stuff gets internalized, and it becomes internal dialogue.
Yeah.
And I don't know what everyone's like, but it's like these sayings, a lot of people I know will admit it. It's like, it's in your head, oh, you're an idiot.
Yes.
Oh, stop that. Oh, you always do that. Those types of, whatever those internal dialogues are.
Yes.
But they're fairly common. And they're not real, but they're all shame-based. And,
No, I thought I'd try something. It didn't work. That's okay. But yeah, so we have, and I always like having a good argument, but we have different perspectives on the drugs. I suppose I see more people who are really struggling to get off these drugs, and you have to work really slowly and carefully to get them off. And quite often they say, when we go back to what the original reason they went on, I go, yeah, you should never have been on them. And people tell me that their psychologist, psychiatrist, whoever it was, they start with 3 months. So people also have this in their head that, oh, okay, I'm going to be on it. They start for 3 months, and then it's another 3 months, and then it's another 3 months. And it's often 12 months before they're even at their, correct dosage.
You don't need to see a psych to get that, just from the doctor. You can get anti-anxiety, anti-depression, and sleeping medicine, all just from the GP.
Right.
And you just, it's not very expensive.
Yeah.
To maintain.
Yeah.
But a lot of people
doesn't fix anything. I think this is the thing. Compared to natural things, it doesn't fix anything. So when we're giving herbs and nutrients, and this is the thing, I always joke about the ANs, Resilien and Relaxan and Adaptan and those sort of things, is that because they're herbal, they're nourishing the body and they're allowing the body to heal.
They're just as strong too, like something I take sometimes, Inflamed.
Yeah.
That's just as strong as those drugs.
Yeah.
Like, that's actually really powerful. Your mood switches like that.
And that's the combination of saffron and activated turmeric. So the turmeric is an anti-inflammatory.
That's interesting. And what they do, because they do that exact thing with a low mood, they pick it up.
Yeah.
And it's like a switch. It's like, oh, that's up now.
Exactly.
Like, that works for me with that. Maybe I assume with some other people.
Yeah.
But that's just as strong.
Yeah.
And it's natural.
Yeah. Okay, we should round it up. I've got little Teddy to pick up soon. So
if we've got a problem, whether it's depression or ADHD, the important thing is to look up, like part of my job, psychoeducation, what are the options available? And there's a lot of things.
Yeah.
There's physical activities you can do. Yoga, they found with treatment-resistant depression and post-traumatic stress disorders helpful. Exercise, yoga, exercise, diet, trying to learn what foods make, Like if you've got the shortage of serotonin, what's the things that the precursors, HTP5?
Yeah, 5-HTP and SAMI and all sorts of things like
And
that.
so what foods have those in them?
Foods high in magnesium, foods high in foods high in minerals.
Right.
You know,
so we can
it's
look up
not going to be ultra processed foods.
Right,
It's
so
not
it's
going to
really
be McDonald's.
right. So if we look at our basic hormones, we're looking at depression. So we want good levels of dopamine, serotonin, oxytocin, and
Yes.
endorphins. And if you look up the foods that make those things,
Yes.
you can get a list.
Yes.
And if you look up a list of activities that produce those hormones, you've got a list. Now you've got a whole bunch of things as well, or other than the drugs that you can try,
Yeah.
just looking on the internet without even going to see anybody.
Yeah.
And
Yes.
that's already a big help for anybody. Well, what activities produce positive hormones,
Yes.
and what foods produce the precursors to make those hormones and neuroreceptors work?
Yeah. Beautiful.
And then getting treatment off a professional for like helping you along the way, or dealing with some of the underlying issues underneath
Yes.
the depression or ADHD, and then you've got a really full set of options that you can use depending on how you feel.
Awesome. Awesome.
Awesome. What do you think?
Go on, David. No. Well,
I'm learning off you.
Well, I just love to, obviously, I love my kinesi for this sort of thing. I like to calm down the survival patterns, open up the frontal cortex, make sure the logical and creative hemispheres are really connected.
Because that's working with the body, because the body keeps the score.
Yeah, that's right.
And so you can pull that backwards.
Yes. And like I mentioned, you know, I mentioned that I pulled a butt muscle a few weeks ago, you know, and that I'm 99% sure it was emotional, because energetically my body went into that gate. You know, it did this twist because I had to stand up for myself. And an hour or two later, I just was in a 10 out of 10 in pain.
It seemed like you had some sort of hip bursitis or something.
Yeah, like it was a physical reaction. No, well, going by so I had two different therapists look at it, and I had a tear.
Yeah.
So I did tear.
Okay.
Yeah. No, there was. But, you know, you take enough supplements, you can reverse these things.
Yeah, well, you can sure make them go better.
Yeah. Good. Excellent. Okay, that's awesome.
Okay, love your work, Madonna.
Have a good one, everyone. Bye.